guys, welcome back to Medical Coding with Blue. Today's episode is all about, do you have to know about medical billing when you're learning medical coding? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this comment, I'm gonna read the comment and then we're gonna get into it. So the viewer says, hi Blue, I'm skipping the billing and coding to focus on just the coding, since that is what I want to do in my career and I already have a background in the medical field. I would be interested to know what you think. So here's the thing. Do you have to know about medical billing to be a medical coder? Yes, you do. Do you have to learn medical billing to take the medical coding certification exams? Yes, you do. The 4 main medical coding certifications, the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC, all test on reimbursement, which is the billing side. Now, why is it important for medical coders to understand medical billing if they're not going to actually do medical billing? Well, let's think about this for a second. When you are coding in a record, right? And you want to make sure that you are paying attention to the payer guidelines, right? Because there's going to be certain procedure codes that are going to be used for certain insurances. Like for example, with the colonoscopies for Medicare, they are reported with the G codes, the HCPCS G codes, right? There's the G codes. I can't think of the G code off the top of my head, but there's 2 ones, the one for the high risk and the one for the average risk, but not necessarily worded that way, but there's also colonoscopy codes in the CPT book. So those are for your commercial insurance. But again, with those G codes, that's going to be your Medicare. So that's knowing about reimbursement. That's understanding those billing and payer guidelines. So it is very important and it is inherent to what we do. And there's a lot of new people that say, well, I don't want to do billing. Well, you don't necessarily have to do billing to know about the billing, all right? And it's very important. There's a lot of things that make it better when you understand the full picture, right? Because as medical coders, we have to know what doctors know while never having gone to medical school. Okay, that's first and foremost. But let's think about that for a second. When I say something like that, I mean that we have to understand about pharma, we have to understand about surgeries, we have to understand about the disease process and pathophysiology and anatomy and physiology. We have to understand all of these things and how the body is connected all together, from the smallest to the biggest thing, from all these organs and how they work together to, have our human function. So there's a lot of things that we have to learn and a lot of things that we have to know. Please do not put on the blinders thinking that just because you don't want to do a certain task like billing, that you don't have to learn about it. You do. Because as I said, in the 4 main medical coding certification exams, all you need is one. They all test on reimbursement, and they test very heavily on reimbursement. So meaning that of all the domains, those are pretty heavily weighted in those exams. So that means that you have to really understand. Again, you don't have to do it. You don't have to do it in the real world as far as like being a biller, but you do have to understand it. And it makes it so much easier when you understand. Exactly as I said in the beginning, with my example about knowing that Medicare requires the reporting of those G codes and not the CPT codes for a colonoscopy. So again, understanding payer guidelines and the methodologies for all of those things, and depending on the setting as well, like the DRGs, you have to understand that, even though that has a lot to do with billing, it also has to do with the coding. So there's all those things all into one. Everything feeds off each other in health information. It's just like CDIs who have a nursing background. That's part of the puzzle, okay? And the great thing about nurses who come over from nursing to CDI is they can look at documentation and they can understand what these lab results mean, and they can understand what the documentation means and what's all included in this procedure, right? But if they don't understand the coding side, which is why I always say that if you're going to go into CDI, if you're a nurse and you want to go into CDI, you need to have a medical coding certification. It is not required for the industry standards. The industry standard says that you don't need to have a medical coding certification to be a CDI, but you just need to be a nurse, right? Having a nursing background is very helpful, right? But if you have a coding background, it's going to make you understand even more so what the coder is looking at, and looking at it through their eyes, and taking that nurse hat off for just a second and putting on that coder hat, so that when a coder goes to you, because the CDI, Clinical Documentation Integrity Expert, right? They are the ones who's going to be the liaison between the doctors and the coders. So they have to be able to understand both sides. Well, nurses and doctors have a built-in relationship already because they've worked together, right? However, nurses and coders, there's a little bit of a disconnect if the nurse does not understand and is not certified in coding. Because a nurse can say, oh, I've done coding before. And sometimes when I talk to nurses, what they mean by that is that they selected from a super bill and those were the codes that they used. No. Selecting from a super bill does not a coder make. Okay, that's first of all. Second of all, if you don't understand the coding guidelines, that's a whole different ball game, okay? So we have guidelines that we have to understand as medical coders. We have sequencing rules that we have to understand as well when it comes to diagnosis codes. And we also have to understand that not all of the diagnoses that are known to mankind are actually in the ICD-10 CM book worded specifically that way. So we have to be able to find its equivalent. And that takes a lot of knowledge, okay? So there's going to be a lot of things that you are not, but that you do have to know. So coders, yes, do have to know about billing and reimbursement. You have to understand those. Even though you don't do it, you still have to understand it. There is no getting around it. And even if you say, well, I'm looking for a program that is just medical coding, not medical billing and coding. Sometimes these organizations and these schools will use medical billing and coding all together to say the same thing, even though they mean coders. They'll say, oh, this is our biller coder, even though that's not what you do. Maybe somebody else does it. They'll still say it that way. Same thing with these schools. When they say that they train in medical billing and coding, it's not that they're training you to be a biller. They're just training you to understand what is billing and what are the fundamentals, because you have to understand that. If you don't understand billing concepts as a coder, you will struggle, because a coder that does not understand billing concepts will not understand the proper use of like modifiers, and when there's increased services, or when there's reduced services or discontinued services, and what that does to the billing side, right? Even though we know what it is, that's not our driver, but we do understand the sequencing. And you only know that if you understand the billing concepts, right? So that's the thing that you have to think about. It's not just black and white. There's a lot of shades of gray in this field. So you do have to know a lot. I have spent a considerable amount of time studying nursing documents and nursing books and nursing things, even though I have no desire at all in my life ever to become a nurse. But what it does do is help me understand the clinical side. I also spend time reading the New England Journal of Medicine. Now, I am not ever going to be a medicine doctor who's practicing medicine, but it's helping me to better understand the surgeons when they speak to me, or when they're writing in their notes. And when they're writing in their notes and their documentation, stuff like that, and I'm reading this, it helps me to better understand what they're saying, because I'm taking the time to read documents that are from their peers, and they're speaking to each other without having that filter of speaking to me as somebody who is not a doctor. Because have you ever noticed that? Like, doctors will speak to you in terms that are easier to understand. Whereas if they get around their own brethren, they're able to say things a little bit more freely without having to filter themselves and think, is this person going to understand this? Am I breaking this down Barney style where they would get it, right? And whereas they're talking with their peers, they can say all these, words that are just way like over our heads most of the time, But what happens when I see something like that, even when I'm reading in these articles, what I do is I pull out the dictionary, I pull out Google, and I start looking it up that way, because it's all part of my learning process. If you don't open up your field of vision when you're studying medical billing and coding, right? Even though you want to just be a coder, if you don't open up your field of vision, what happens is you get tunnel vision. And when you get that tunnel vision, then you're going to miss a lot of things along the way. Rather than just being prepared and knowing all of these things. Now, this is not to overwhelm you, because some people will think, oh my gosh, I got to study all these things, I got to do it. No. These things take time to build, and they will build, right? They will build over time, but it's just a matter of, taking it one step at a time. I didn't start off reading the New England Journal of Medicine. That took a little bit of inspiration one day. And I was just like, is it intimidating, some of those articles in there? Absolutely. And can I pronounce all of the words? Absolutely not. But it doesn't stop me. And there was times when I thought, oh, I don't need to look at this thing about nursing. But then I would see, well, they have like these little tips and tricks to remember certain things, and what does a low level of this mean, and what does this indicate, and that kind of thing. And that does help me to, when I'm looking at documentation, or when I'm having to read something and having to comprehend it, it does help me to understand those things. So, it helps me. But that's me allowing myself to have a wider field of vision. And like I said, the day that I was inspired to start reading the New England Journal of Medicine, because I thought one day how cool that would be. And then when I started reading it, I was like, now this stuff is starting to make more sense. When I'm thinking about these surgeries, and, when I'm thinking about all these other things, when it comes to medicine, it makes more sense now, because I've taken the time to open my field of vision, and that's where you have to be as a future coder or as a future biller. It's not a task that you have to perform, but it is something that you do have to know and understand. There's nothing wrong with understanding things outside of the straight line of what you want to do, which is coding. Because if you understand all the other things, it's going to make you better prepared. It goes back to the analogy I first said about the CDI that does not understand coding. A CDI that does not understand coding will always struggle with being a CDI. And before anybody says, oh, no, okay, hold on, hold your fire, hold your fire. Because think about it for a second. If you truly understood the fundamentals of coding, from the guidelines to the sequencing, to why we select certain codes and why certain codes apply and why other codes do not apply. If you truly understood that, your capabilities as a CDI would rise, because then you would know about the reason that coders are asking certain questions, and if they're missing something, if they don't quite understand something, because the job of a CDI is to be an educator to coders and an educator to providers. So that's where, having that understanding, that full eclipse understanding, is going to really come in handy. At least that's just my my thoughts on it anyway. I have spent a lot of time looking at other things that I should know as a coder. And understanding the billing part was a huge part of, okay, I have to, if I'm going to call myself a well-rounded coder, I need to know everything. I need to know about billing. So I did more research about billing. I have viewers on my channel here and even on my Patreon channel that do ask me billing questions. Now, I can't always answer their questions, but we try to figure it out together. And we've been successful. There's been a few people who have reached out And we've done sessions and I'm like, okay, well, let's look this up. Let's try to research this. And we find the answers together. And it helps me to learn and it helps that individual to learn. But if I was so close-minded and like, oh no, I only do coding and I don't talk about this and I don't talk about that, you know what I mean? Like I would be missing out. My audience would be missing out. And my audience is very important to me. You know, the content that I put out on my channel is original to me. It is original to me. These are all my words and these are all my ideas that I come up with when it comes to show topics and things. It's led by you all, the viewer, and your requests for information like this, you know, like, you know, what are your thoughts on that? I want to only do coding. Do I have to learn about the billing? And I only want to concentrate on the coding. You can't neglect learning about billing, period. You can't. And so expect that to be on your exam. Expect yourself to know. And that's what you have to be prepared for, okay? Because again, being a well-rounded coder is not just about knowing about the billing, knowing about the coding. It is about being the entire package, about being that that talkative professional in the appropriate moments, right? When you have to communicate with these providers who have different personalities. So you have to learn about body language. Why is learning body language important to a coder? Because it'll help you to understand if the person is receiving your message or not, or if they're still confused. Because sometimes providers will tell you, yes, I understand what you're saying, but their body language will show that they don't understand. And so because of that, if you know, right? If you know about body language and you're able to read it, then you'll know that you can pivot your approach and you can say it in a different way so that they can get it. Okay? It's the same thing with learning all these other subjects. So if they're trying to teach you it in medical coding school, there is a reason for it. It is part of the curriculum. It is part of the programs. Even on my independent study video that I have out there, there's a reimbursement part, and I talk about reimbursement and what you should study and things like that, and what you should know, and what are some helpful websites. I put that together, okay? Me. I put that together for all of you because that's important for you all to know. So don't skip because you think you don't need it. You need it, okay? And if you have prior experience in the medical field, that's great, but it doesn't always translate to what we know as medical coders, okay? And I even say that to my nurses. You know, if you think that everything that you're going to pick it up so fast because you're a nurse and, you know, coding should be easy. Coding is not easy. You know, coding is not easy. And if you proclaim that it is, well, I don't know what to tell you because it is not. And trust me, there's plenty of nurses out there that have learned the hard way to respect the field of medical coding because it is difficult. It's not easy. And that's what a lot of people need to learn, is that medical coding is not easy. The things that we have to know, and whether you feel they are relevant or not, we have to learn them. You know, and that those things change every year as well. It's not like it stays the same. The guidelines don't stay the same every year. They change. Same thing with the billing guidelines, you know. And when you're dealing with government insurance and commercial insurance, these are two different mindsets. The coder still has to understand that, okay? Because again, there's going to be different codes that are going to be applied to these different, you know, billing claims. So that's just something that you have to know, guys. Don't think that you can skip on anything that is being put in front of you in this program, okay? Don't skip over it because you're only going to hurt yourself in the long run with trying to pass these exams, because that's part of the test that you're not studying. It doesn't make sense, right? So make sure that you study all of it because it is all needed, all right? So with that said, I'm going to go ahead and wrap this one up. Tomorrow, well, it's Wednesday today, but Friday the 25th will be my once a month live. So I will be live at 7:30. I have a topic. What am I talking about? Friday night. Oh, how to maintain your knowledge while you're looking for a job in medical coding, because a lot of people ask me about that. So I will be talking about that. I will be also taking any of your questions that are in the chat, and so we'll be discussing that then. So I'll be live at 5:30 p.m. Pacific Standard Time, 7:30 p.m. Central Standard Time, 8:30 p.m. Eastern Standard Time on Friday, August the 25th. Okay, so I will see y'all then. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.